So, Grumpy, you know what we should do?
What?
We should make our own TV show, but make it like super medically inaccurate.
Doesn't that already exist?
Does it?
All right. I'm not going to lie, I'm pretty excited about this episode.
Oh, yeah? What is that?
We know there's different procedures I get to do, and there's one procedure I am particularly passionate about.
Fecal disimpaction.
Okay, that's super rude, first of all. Second of all, I will order an enema every single time so the nurse has to deal with it instead of me before I try to do a disimpaction. So that is on you, Fern.
Classic attending.
Anyway, central lines. I love central lines.
Yeah, who doesn't?
Well, let's just kind of see. We got the resident. They're going to do one. It's not going to be like overly dramatic or anything, right?
Usually isn't.
All right, let's see.
Do you think you can sleep?
Yeah, I think so. Hey, can I ask you something?
Of course.
What are my odds? I mean, is there a chance I can survive this?
I looked at your chart, and you're on intense protocol.
You should be on concussion protocol.
The next few months will be rough, but you can beat this.
Is there a chance I can survive this?
Well, I'm an intern, and I did look at your chart. I didn't really understand any of it, but I did see that your potassium's low, so I'll go ahead and replace that. You can beat this.
How are you feeling, Lily?
A bit weak all of a sudden.
Your blood pressure is low, 80 over 40. It was 120 over 90 a minute ago. Lily! Lily! Lily!
Well, shit, that was fast.
Oh my god, how much potassium did I order?
Lily! Where's Conrad?
You in the ER, why? What's wrong?
Lily's BP is 70 over 38 and dropping. Can we please get rapid response now?
If I were the nurse practitioner, I'd be like, "Sir, why are you yelling in the family waiting room right now? I'll call for some help."
Get a CBC, CMP, LFTs, lactate. Is the IV wide open?
Stolic's fluctuating, but it's not good.
We're 3 liters in already. It's sepsis.
All right, I just gotta say it. The way he's standing at the foot of the bed, I need a CBC, I need a CMP, lactate, get that wide open. I am medically bricked right now.
And she's over there milking those IV bags like she knows what she's doing.
I know, it's provocative. It gets you going. You know, it's like, is this lady gonna survive? What do we do next?
Want me to give Norep peripherally?
No, get a central line.
No. You've never done one. We wait for Conrad.
We can't. She'll die.
Prepare the iodine swabs. We need Norep and Basso on the table. Get farm here now.
Okay, I think we need to give everybody some context. What do you think?
Sure.
So what they're talking about right now is her blood pressure's too low. So the first thing they were trying is they're giving her fluids. Sometimes that's going to help with blood pressure. I like that. 3 liters.
That patient's like, what, 120 pounds?
Yeah, maybe a little bit too much, but whatever. They're trying it. It's spunky. I like it.
Yeah.
Now their next approach is they're going to give medications that can increase blood pressure, pressors, and that's what they're talking about right here. So let's go back and see again what they said.
Want me to give Norep peripherally?
No, get a central line.
No. You've never done one. We wait for Conrad.
We can't. She'll die.
Prepare the iodine swabs.
Okay, so there's 2 big things that I think are worth pointing out in this. Number 1, the resident is saying we can't give this medication through a peripheral IV. We need a central line. That is wrong.
And the second thing is the nurse practitioner says you're not allowed to do this procedure until there's a supervisor here. And that is correct.
Ding, 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 ding.
We need Norep and Basso on the table. Get farm here now.
Call farm. I need Vaso for this sepsis patient.
I want 12 leads on her at all times. Call for an ultrasound as backup.
Scalpel. Scalpel.
I'm sorry, did you notice how he said scalpel that second time?
Oh, yeah.
I think he's bricked too.
Scalpel.
In all seriousness, though, why do you think she was giving him that look?
Maybe because the first step of this procedure has nothing to do with a scalpel. I actually don't know what his plan here is. I'm pretty sure he's just gonna blindly take a scalpel to her chest wall.
Bloodletting.
Yeah, I mean, definitely.
Have respiratory on page, please. Oh, good. Her pressure's crashing. We need a central line now.
I can see that. Go on. Do it.
Conrad, Dad, seriously.
You heard me.
She's right. You should do it, not me.
Then why are you here? Pre-med, med school, MCATs, was that just for fun?
SATs, pre-SATs, state testing, learning how to read. Was that all just for fun?
Come on, be a doctor, or go be something else.
Stats are slipping. Stats are slipping. Pressure 70/38 and dropping fast.
That's normal.
So I'm like actually cringing as we watch this. You know, I have misgivings with the scalpel first because that's not how this works. But after he does the scalpel, it looks like the next move is to put the wire in, which is part of the procedure. But even this part they're getting wrong because he's going the wrong direction. Going left like that, if you were doing a subclavian line, is not the way you do it. You'd be going towards the patient's head. So it's just like, I don't know who directed them in this, but it's wrong. It's so wrong, it doesn't even merit further discussion.
Okay. Keep going. So far, you haven't killed her.
Looks like we got a second brick in the house.
Medicine, you know? You know what I'm saying?
Start at 5 micrograms. Titrate up as needed. Don't look at him. I'm right and you know it.
What next?
When her pressure level's out, wean her off the norepi and then drown her in fluids.
Congratulations, we just busted your cherry.
Congratulations, your first patient death that you're solely responsible for.
Just busted your cherry, buddy. Well done.
You'll be hearing from lawyers soon.
I can't help but feel like, what are the vibes right now? Like, this gives me like Top Gun shirtless volleyball scene vibes. They're just really vibing each other. You know what I'm saying? You know what I'm saying, though? You know what I'm
Love
saying?
that procedure too.
You know what I'm saying?
You know, this is the most relatable part. Sometimes after a shift, you just gotta go, time to walk away.
I'm just picturing the people in the hallway that are like watching a doctor with like dirty gloves and a dirty, bloody gown, just like walking down the hallway, rubbing his hair. Like, job well done.
Yeah, they're like, oh my God, am I in a Grey's Anatomy episode?
And then someone else is like, oh my God, I'm going to die here.
Well, Grumpy, once again, the resident has delivered us a great how to not do something.
Yeah. I don't even know, though, if people are really going to be led astray because they showed so little of the actual procedure that not much to conclude. Just remember, medical students, don't start a central line with a scalpel.
And please get a supervisor if it's your first time.
And I think just taking a step back, oddly sexual episode.
Oof. I mean, I'm still bricked.
Yeah, it was, there's a lot of tension in the air in that room. All three of them.
You could cut it with a scalpel.
Oh, I see what you did there. That's a good one. Well, you know, I hope they explore that further because that's an interesting triangle. Well, anyway, thanks for hanging out with us, and we'll try and bring you some more medical content when we can.